Nagaland reports highest single-day spike in the number of COVID-19 cases with the detection of 69 cases this morning. Peren reports 65 out of the 69 positive cases and surpasses Mon as the district with the highest number of COVID-19 active cases. Zenoboto joins the COVID-19 map of the state with the report of 1 case. The entire hospital is sealed. Number of confirmed cases in the state jumped to 280. Nagaland's Health and Family Welfare Minister says the BSL-2 lab at CIHSR Dimapur is on the verge of completion and inauguration of the lab will be done soon to cater to the needs of the people. Says quality of the work will not be compromised despite the delay in its functioning. And India today added 14,821 new COVID-19 cases, pushing the infection tally to 4,25,282, while the death toll rise to 13,699. Number of recoveries also continued to surge with 2,37,195 patients cured so far, while there are 1,74,387 active cases. Well, hello viewers, welcome to News and Trends, and you're watching the daily news broadcast that's coming to you from our studios here in Nagaland. Here is our top story. Nagaland reported the highest single-day spike in the number of COVID-19 cases with the detection of 69 cases this morning. The 69 new cases were detected from 275 samples that were tested. Informing this in a tweet this morning, State's Health and Family Welfare Minister Pom said, out of 275 samples tested, 69 new cases of COVID-19 positive have been reported, 65 patients from Peren Quarantine Center, 3 from Dimapur Quarantine Center and 1 from Zenoboto Quarantine Center. With this, the number of confirmed cases in the state has jumped to 280. However, with 141 recoveries reported so far, the number of active cases in the state is 139. Out of the 69 new cases, 65 cases are from Peren, 3 in Dimapur and 1 in Zenoboto. With this, Peren surpasses Mon as the district with the highest number of COVID-19 active cases at 71, followed by Mon with 23, Kohima with 21, Dimapur 19, Twengsang 3, and Thek and Zenoboto 1 each. Zenoboto also joined the COVID-19 map of the state with the report of the 1 case today. According to sources, the entire district hospital has been cordoned off and no other patients except the positive patient and health workers are being allowed within the hospital premises. With this, 7 districts in Nagaland have so far reported 1 or more cases of COVID-19. State's Health and Family Welfare Minister Pom today said that the BSL-2 lab at CIHSR Dimapur is on the verge of completion and inauguration of the lab will be done soon, which will cater to the needs of the people. During his visit to the CIHSR today, the minister said the quality of the work will not be compromised, and because of that, the completion of the lab is taking time. Nagaland Minister for Health and Family Welfare Pom in his final inspection of the ongoing BSL-2 installation at CIHSR Dimapur today said that the lab would be inaugurated within a few days' time. The minister, who was also accompanied by advisor IPR, SEART and village guard Tushi Wongtong and guided by Director CIHSR Dr. Sedevi and Dr. Nito Yepthomi. The minister also visited the processing room, the RNA extraction room, sample storage room kept at -80 degrees Celsius, the polymerase chain reaction PCR, and was explained in detail on how the BSL-2 would function. Director CIHSR Dr. Sedevi informed that ICMR has given approval for the lab and it would be operational once ICMR are satisfied with the sample tests done with BSL-2 and the results of which would be uploaded probably by tomorrow. If ICMR are satisfied and happy, they will give us the go-ahead and the lab would be operational, Dr. Sedevi informed. According to DIPR, he also highlighted on the multi-utility of such labs and explained that the lab facility could be used for several other conditions like TB, HIV, hepatitis, etc., and would immensely strengthen the medical facility and infrastructure. Further, Dr. Sedevi also mentioned that many Naga medical scholars who are working and doing research in the mainland will get opportunity to come and work in Nagaland with the installation of such facilities. Already 2 PhD Naga scholars has applied and one has already joined, he informed. Dr. Nito Yepthomi informed the visiting officials that 12 designated staff headed by him would be running the lab, which will also comprise of 2 pathologists and 1 scientist who will be working in shifts. He also informed that the present strength of 12 staff would be able to test around 150 to 200 samples, but cited that more manpower would be required if the sample goes beyond 200 per day. India today added 14,821 new COVID-19 cases, pushing the infection tally to 4,25,282, while the death roll rose to 13,699 with 445 new fatalities, according to the Union Health Ministry data. The number of recoveries also continued to surge with 2,37,195 patients cured so far, while there were 1,74,387 active cases, according to the updated figure at 8 a.m. In the last 24 hours, a total of 9,440 COVID-19 patients have recovered, taking the recovery rate to 55.77%, officials said. India is the 4th worst hit nation hit by the pandemic after the United States, Brazil, and Russia. According to the Johns Hopkins University, which has been compiling COVID-19 data from all over the world, India is in the 8th position in terms of death toll. Maharashtra has reported the highest number of cases at 1,32,075, followed by Delhi at 59,746, Tamil Nadu at 59,377, Gujarat at 27,260, according to the ministry data. In the northeast, Assam has reported 5,388 cases of the pathogen. A total of 1,221 cases have been reported from Tripura. Manipur has 841 COVID-19 cases. Mizoram has 141. Arunachal Pradesh has 135. Meghalaya 44, and Sikkim has reported 78 cases till now. The total number of global coronavirus cases has increased to 89,44,215, while the death toll has reached 4,68,121, according to the Johns Hopkins University. With 22,79,879 confirmed cases and 1,19,969 deaths, the US currently accounts for the highest number of infections and fatalities in the world. In terms of cases, Brazil comes in the second place with 10,83,341 infections. This was followed by Russia with 5,83,879, India with 4,25,282, and the United Kingdom with 3,05,803. Regarding fatalities, Brazil comes in the second position after the US with 50,591 COVID-19 deaths. Deputy Commissioner Dimapur Anup Kinchi activated the 93-bedded COVID care center at Chumukedima, Dimapur today in the presence of Commissioner Police Dimapur Roti Hutetsio, CMO Dimapur Dr. T.S. Sanap Ponganer, MS District Hospital Dimapur Dr. Keshto Jimomi, and Director CIHSR Dr. Sedevi Angami. The Health and Family Welfare Training located at Chumukedima has been converted into a COVID care center, and CIHSR, in collaboration with the Health and Family Welfare Department, will be taking care of the center. Deputy Commissioner Dimapur in his address cited that the COVID care center Chumukedima will be a place between hospital and quarantine center. While mentioning about the high recovery rate in Nagaland with more than 66%, Anup thanked God and also acknowledged the selfless sacrifices of the medical staff and policemen. He lauded the government and private doctors for working day and night taking care of all the 67 quarantine centers. Commissioner of Police Roti Hutetsio felt that government employees posted at Dimapur were fortunate, stating that working together in the fight against COVID-19 pandemic was an opportunity for contributing something towards the society. He appealed to all to continue to work together. MS Dimapur Dr. Kashto Jimomi observed that besides COVID cases, problems of normal patients with other ailments need to be addressed, as the only government setup has been working for the past 3 months day and night for COVID cases. Further, he noted that presently all positive cases are young people, but felt that if community transmission starts, it will also affect all people irrespective of age, and people with morbidity will be vulnerable, and therefore Dr. Kashto felt the need of preparing and arranging more hospitals. Director CIHSR Dr. Sedevi said it was an opportunity to work in partnership with the government and felt that such initiatives could continue even in future. Diseases are not government or private but has to be joint responsibility of all, Dr. Sedevi said. CMO Dimapur delivered the welcome note while Pastor Town Baptist Church Chumugidima Reverend Sazo Kere offered word of prayer.
We are hopeful that the lab days and lab will start soon. Because that lab is very critical. Not only this to confirm the concept.
In order to ensure the smooth management of the quarantine centers as well as to discourage practices of bringing food by the parents and relatives of the returnees presently in quarantine centers, Deputy Commissioner of Peren Senti Wapong Iyer has issued an order stating that packages of food or other edible commodities, medicines delivered by the parents and relatives for the wards in any of the government-managed quarantine facilities shall be strictly prohibited. According to DIPR, this order comes after reports were received that parents and relatives of the returnees accommodated at the different quarantine facilities are bringing packages of food and other commodities to their wards, resulting in unnecessary harassment of the facility managers as well as other staff manning the quarantine facilities. Altogether, 232 people reached Dimapur by flight today. A DIPR report said that out of 232, Air India brought 122 from Kolkata and 6 from Guwahati, while Indigo flight brought 104 from Kolkata. Kohima passengers were sent to Kohima after necessary medical screening at the airport, while remaining passengers were taken to Agri Expo by Nagaland State Transport buses for further segregation and placement to different quarantine centers after going through mandatory procedures. State capital Kohima from today saw the odd-even vehicular rule, which eased traffic considerably in the city, which otherwise witnessed heavy jam on other days. The new system is being implemented in the interest of public safety and to minimize non-essential movement of vehicles in Kohima, and was announced on June 19. This rule will be enforced in the state capital from today till June 30. As per an order issued by Senior Superintendent of Police Kohima on June 19, vehicles registrations ending with odd numbers 1, 3, 5, 7 and 9 will be allowed on dates ending with odd numbers, while those with even numbers 0, 2, 4, 6, 8 are permitted to ply on even dated days. The order would be implemented from June 22nd to 30th June except on June 28, which is Sunday, in all areas within Kohima municipality. However, emergency vehicles belonging to police, prison, administration, paramilitary, medical, NST buses, government staff buses, fire services, NSDMA and SDRF, press and two-wheelers, trucks carrying emergency medical equipments, commodities and LPG cylinders, and interstate trucks carrying essential commodities bound for the state of Manipur were exempted from the order. According to the Department of Health and Family Welfare, out of the total of 139 active cases, 19 persons are at District Hospital Dimapur, 21 patients are presently undergoing treatment at Kohima, 23 are admitted in Mon District Hospital, 71 patients are at Peren, 1 patient is at Phek Hospital, 1 patient at Zinaboto Hospital, and 3 at Twensang. All 139 positive cases are asymptomatic. 113 persons have recovered from Dimapur, 21 from Kohima, 2 from Peren, and 5 from Twensang. With this, the latest figures for recovered patients stand at 141. The district-wise distribution of cases by domicile district are Kohima 17, Dimapur 33, Mogokchung 0, Phek 2, Zinaboto 2, Twensang 13, Mon 48, Wokha 8, Kifri 4, Longland 0, Peren 149, and others 3. That's all we have time for in this edition of News Broadcast. But before we leave you, here's another reminder that you can send in your videos at the WhatsApp number flashed below and be part of this venture of being a citizen journalist. Do let us know what's happening in your village, your district, or your locality so that we can share your videos with the rest of the viewers watching this broadcast. Meanwhile, stay safe, practice safe health hygiene, and maintain social distancing wherever you are. But most importantly, take good care of yourself. From all of us here, it's bye for now, and thanks for watching.